Now we will discuss summary of radial nerve in a very brief manner. Radial nerve is branched from the posterior cord of brachial plexus and the root value is C5, C6, C7, C8 and T1. You can easily remember because radial nerve is taking the contribution from the all roots which are forming the brachial plexus. We know that brachial plexus will be formed with the C5 to T1 nerve roots. So here C5 to T1 nerve roots. Then it is present behind the third part of axillary artery and proximal part of brachial artery and in front of structures which are forming the posterior wall of axilla. Those are subscapularis, latissimus dorsi and teres major. Here latissimus dorsi will be there and here is the teres major. Then it leaves the axilla and enters into the posterior compartment through lower triangular space along with profunda brachivessels. It passes through the lower triangular space and enters into the spiral groove. At the lateral part of spiral groove, it pierces the lateral intramuscular septum. Again it becomes anterior. In the anterior aspect of the forearm, it is present in between the brachialis muscle and brachioradialis extensor carpi radialis longus laterally. Then at the level of the lateral epicondyle, it will be divided into two terminal branches. Those are superficial branch and deep branch. Superficial branch is passing underneath the brachioradialis up to the junction of upper 2/3 and lower 1/3. At this level, it winds around the lateral part of the radius and appears in the dorsal aspect of the forearm. Then it descends down up to the anatomical snuff box over the extensor retinaculum and it gives two proper digital branches on either side of the thumb, one proper digital branch along the radial side of index finger, one common digital branch which will be supplying to the adjacent sides of index finger and the middle finger, then one more common digital branch which will be supplying adjacent sides of middle finger and ring finger. Actually here this branch or this common digital branch will be replaced by the branch of ulnar nerve. Because of that only lateral 2.5 supplied by the radial nerve, medial 2.5 digits will be supplied by the ulnar nerve. Then coming to the deep branch. Deep branch is one of the terminal branch of radial nerve. It passes through the substance of the supinator muscle. Along with that it winds around the neck of the radius and appears in the posterior aspect of the forearm in between the superficial set and deep set of extensor compartment of forearm. Then it descends down, passes through the fourth compartment of extensor retinaculum. Opposite to the wrist joint, it forms a pseudoganglion. After forming the pseudoganglion, it supplies to the adjacent joints. Those are inferior radioulnar joint, wrist joint and intercarpal joints and it will be terminated. Now, what are the branches of radial nerve? See here, branches in the axilla, two muscular branches, one to the long head, another is to the medial head. Cutaneous branches, one cutaneous branch, that is posterior cutaneous nerve of arm. Then branches in the spiral groove, three muscular branches, two cutaneous branches. Muscular branches are one to the lateral head, one to the medial head. The nerve which is supplying to the medial head, it descends down within the substance of the medial head and reaches to the anconeus and it supplies to that muscle. Then cutaneous branches, lower lateral cutaneous nerve of arm and posterior cutaneous nerve of forearm. Those are the branches in the spiral groove. Then branches at the lower lateral part of the arm. Radial nerve proper will give one branch to the brachioradialis, one branch to the extensor carpi radialis longus and one branch to the brachialis muscle. Actually these fibers are proprioceptive fibers. Then if you come into the deep branch, before entering into the supinator muscle, it will be supplying to the extensor carpi radialis brevis and supinator. Then within the substance of the supinator muscle, it will give one more twig to the supinator. After that, deep branch will leave the supinator muscle. It appears in the posterior compartment of forearm in between the superficial set and deep set. Here it supplies to the extensor digitorum, extensor digiti minimi and extensor carpi ulnaris. Along with that, it supplies to the deep muscles of posterior compartment. Those are abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus and extensor indicis. So this is about the course and branches of the radial nerve. Then if you come into the applied aspect, if there is injury in the axilla, all extensor compartment muscles of arm and forearm will be paralyzed, which leads to loss of extension of elbow, so that elbow in the flexed position, and loss of extension of wrist, so that wrist will be in the flexed position. This is what we call wrist drop. But if the injury in the spiral groove level, elbow extension will be remaining because long head and medial head has been already supplied in the axilla, but wrist drop will be there. Then if there is injury in the radial tunnel, wrist drop will not be there because extensor carpi, radialis, longus and brevis, those muscles are strongest muscles. Those are supplied before entering into the radial tunnel. Radial tunnel means the space or the tunnel which is present in between the upper margin of the supinator muscle and the radius. If there is injury at the level of the radial tunnel, wrist drop will not be there, but extension of fingers will be lost because of the extensor digitorum, extensor indicis, extensor digiti minimi paralyzed. That's it about the complete radial nerve course, branches and its applied aspects. That's it for this session.